So the concept of ama and viruddhahara, so this, if you see both focally, which has dire consequences, one such is allergic reaction. So this can be said that the majority of the patients which we come across in the day-to-day practice, they say either environmental factor or the factors related to the food or the precipitating factors for the, in addition to the other factors which are going to be discussed here. So if you see factors involved in allergy, if you sum up from all the classics, so these are all the factors. Viruddha, asatmya ahara, this very broad concept, viruddha and asatmya ahara, unsuitable food, and viruddha, incompatible food. Suppression of physical, that is natural urges, vegadharana is also considered as one of the reasons. Erroneous sleep habits, nidra viparya, alpata. So this is commonly we come across in my practice with the patient, especially techies, they have the allergic nature, especially allergic rhinitis. If we ask them that their sleeping hours are narrowed, less than 6 hours. If they have less than 6 hours of sleep, definitely the morning they are going to get the allergic nature. So sleep is also one of the important factors for mitigating the allergic nature in the body. So emotional factors, this is also seen, manovegas, if they are exposed to the negative emotions, there also they are going to cause the precipitation. Environmental factors like dust, pollen, this is also described in Ayurvedic classics while dealing with the pratishaya. And the excessive physical activity or coitus, ati vyayama, ati vyavaya, both are the leading factors for triggering the allergic reactions. And smoking, pollution, so they are also incorporated. So allergic respiratory diseases at the nasal level, at the bronchial tube level, bronchial tube with lung tissue level. So these three diseases are taken into consideration for today's description. Now let us go to the allergic rhinitis, which is a very common factor where these perennial allergic rhinitis or seasonal allergic rhinitis, both are the two different manifestations we commonly come across. Every day they get the allergic nature, that is perennial, and only seasonally, as we see in the Western countries, hay fever, a pollen index is given, environmental pollen index is given in certain countries where the high pollen contents are there in the environment. Majority of the people used to get the allergic nature. So rhinitis may present either alone or in combination with asthma. This is also commonly seen because typical symptoms of allergic rhinitis, you come across sneezing, running nose, nasal block, and even discomfort or even itching in the surrounding to the eyes and itching in the throat. So if you see here, allergic salute is a very commonly we come across. They always say like this, and this is called as allergic salute as it is described in modern. And once you do the allergic salute for longer period, Darier's line is formed in between cartilaginous and bone nose. There is a line seen that I will show in the next picture. So that is called Darier's line. By seeing the Darier's line, you can say you have the allergic rhinitis, then they say yes, allergic rhinitis is there. So allergic shiners, the lower lid of the eye is also swollen. By seeing that, once the patient comes to you, if you just observe them, then immediately you can say that there is an allergic nature in you. Here you can see the Darier's line in between the bony and cartilaginous area. The salute, as you have seen there, this is an allergic salute. And here you can see the lower lid, swollen lower lid, that is called allergic shiners. These 2-3 manifestations you commonly come across, but if you see, you also nowadays come across the nasal endoscopy reports also by coming to you, because they are already fed with ENTs and they will come to you because they might have gone to polypectomy, septoplasty, and even antral wash, still their problem is lingering, then they will come to Ayurvedic doctor. So here this is a normal one, and on the right side you can see this is a swollen one, and here acute sinusitis where the pus formation is there, letting out from the sinus entry, and here nasal polyps is also formed. So these are all effects of the allergic rhinitis, but only the modern medicine can remove these effects. Polypectomy can be done, septoplasty can be done, antral wash can be done, but the allergic nature will be continued. Again, they will get the problems still after undergoing the treatment from the modern doctor. So, if you see Ayurvedic description, Dalhana commentary says, Vatam prati abhimukam shayo gamanam kafadinam yatra sa pratishaya. It goes against the way of the air. Air is inhaled usually. So, against that air inhalation, the kapha is coming out. So, that is what the Dalhana commentary says. So, the descriptions are also given. Dhumo rajaha, Sitam ati pratapaha. Dhumo raja, Dhuma raja. Both, even dust is also said in Ayurvedic classics. And Sandharanam Mutra Purishayosya. This is also very important thing which you have to take care. You have to have a checklist while practicing. You have to say that this, whether you have this quality, and you have to forbade that quality. And sleeping hours are normal or not, then you have to ask them to correct the sleeping hours. So these are all to be done as a Nidana Parivarjanam. So what are the causes actually, Pratishaya? These are all the causes described, and manifestation of Pratishaya is also Bhaved Guru Siro Mukhaha Shukla Bhasa Sunaksho. Sunaksha is there. That is what the description is also given. Shiners. Siro Gala Oshta Talu Nam Kanduyanam. So this is the itching sensation inside. So these are all typical expressions of the allergic rhinitis as described in Susruta. Dryness of mouth, continuous sneezing, impaired olfactory perception, pricking pain, pain in teeth, temple areas, yes. Then what is the treatment procedure? So because I will sum up the treatment procedure for all the allergic natures at the end, but let me say actually what the Samhitas say. Sarvesham pratishayanam vatatmakatvat sarvesham eva sarpipanam. Sarpipana is considered to be the best one. So among the Sarpipana, Vidaryadi Grita is one of the best practices which I used to do regularly in my day-to-day practice. Then we have different line of treatments, but if you say the very important to be focused is Vata Kapha Hara treatment has to be followed. If the Pitta is aggravated, then you need to go for the Pitta management, but initially it is a Vata Kapha predominant. Snehan Svedana Pradhana Gandusha Dharana is also good. Kanchanara Guggulu, Naradiya Lashmilas Ras, Chitragharitaki Leshyam. So whenever you are dealing with allergic respiratory diseases, one rasayana has to be given. So because that is described in Ayurvedic classics, Haritaki is one of the ingredients for Agastya rasayana, Chitragharitaki, Vyagra Haritaki. All these, Haritaki has become a main ingredient of the allergic yogas. Panchalavana Siddha, Vidaryadi Gana Siddha Gritam for Nashyakarma. Nashyakarma is also a very essential thing. Pippali Shigru Bijani Vidangam Marichani for Avapidana Nashya. So this also we practiced, because once you desensitize the nostril, regularly giving some Nashya which is irritative in nature, then gradually his sensitivity will be reduced, and then he will not respond to any external factors in the course of time. This is also commonly we come across, that is the reason why. So intake of Dashamula Kadutrayam and Vyagradi Kashayam are widely used by me for the regular practice, in the day-to-day practice. And do's and don'ts of Pratishaya, very important things are narrated. Nivata Shayya Asana Chestanan. That means Nivata Shayya, direct air exposure is forbidden for them. That is very important. Murdne Guru Ushna Cha Tadaiva Vasaha. That means you should cover the head with something which is heavy, that is thick, and also it should give warmness. And Tishna Vireka is also advised. And Ruksha Yavanam, dry food with yavas, barley, is advised. Vijayasya Sevya, Haritaki is one of the important drugs as it is incorporated in the sutra itself. So that is the reason why whatever that we say, the Chitrag Haritaki, Vyagri Haritaki, Agastya Haritaki, all these Haritakis are very much, whenever you are dealing with allergic respiratory diseases, you remember the Haritaki and you remember the sleep pattern, and also go for one Rasayana. And very important thing is Vata Anulomana is also very important, Vata Anulomana. So Anulomana, actually the Haritaki is going to do it. Svedana, Virechana, Vamana and Avapedana Nasya are very important, considered by the Susruta Uttarasthana. This is also, Ghratapanam is best in Pratishaya. This is also, I already told you. Siro Virechana is also described, but in my practice, I regularly use the Anutaila Nashyam. Anutaila Nashyam, nowadays, capsule Anutaila Nashya has come. So, regular Pratimarsha Nashya is done to them for about 6 weeks or 8 weeks regularly, and then gradually their nasal congestion and nasal irritation will be minimized, because this is a desensitization technique. So, apachyamanasya hi pachanardham svedo hito amlair himamcha bhojyam nishevyamanam paisa ardrakam va sampadye ichu vikara yogai. Ichu vikaras can be used, and payasa ardrakam also can be nishevyamana. This can be taken. So, these are all, of course, classical references which are highlighted, but if you see the publications, evidence accumulation, Guduchi is considered as one of the important herbs which can be used in when you are practicing in the rural area where no other medicine is available. If the Guduchi is available in the surroundings, you can ask them to take regularly. So, it reported to relieve sneezing, nasal discharge and nasal obstruction, nasal pruritus in patients with allergic rhinitis. This has been published in Ethnopharmacology in 2000. So, this is of course Guduchi, which is familiar to you. And if Pratishaya is not treated, what will happen? This is said, Kasa Agnisada Sofasya Vruddha Kurvanti Pinasa. So, it will cause the Kasa. In the course of time, it can create the Kasa, that is cough can be possible. Then what is Kasa? So, here also this is a etymological derivation, and also you can see Kasati Siram Kantad Urdhvam Gacchati Vayuriti Kasa. This is familiar to you. Despite considerable advances in the understanding of the cough, the effective management of patients, probably you can go through the publications which are there in the respiratory medicine modern system. They consider that cough syrups are only placebos. As such, the modern system, even including the major medical books of modern system, they never advise the antitussive drugs. Antitussive drugs are placebos, what they consider, because that is true, because the things have to be understood in a different way. Why the Kasa comes, as per Ayurvedic classics, you can see here, Dhumopagatat Rasatastadaiva Vyayama Ruchana Nishevanasya. If you regularly go for 10 times 10 cups of coffee, then you will get cough. If you are exposed to the Rucha Ahara, nowadays millets is widely used. You go for regular use of millets, then again the Rucha Guna is increased in the body. Rucha is going to induce this Sushka Kasa. So, these are the eating of foods which induce dryness, regurgitation of ingested food. This is what actually Iroti Vaktrat Sahasa Sadosho Manishibihi Kasa iti Pradishta. This is what the regurgitation of ingested food is also one of the factors, as modern systems say, GRD, gastroesophageal reflux disorder, is going to cause the cough. But if you see the prodromata, feeling of husky filled, itching in neck, difficulty in deglutition, general cough without expectoration, pain in flanks, chest and head, continuous hoarse voice, these are all common manifestations, using stepwise approach known as the anatomic diagnostic protocol. So, this is what the asthma, either cough variant asthma, rhinosynovitis associated with postnasal drip syndrome, or gastroesophageal reflux. they see the cough in only three ways, you remember. Either whether it is reflected from the cough variant asthma, whether patient is asthmatic and getting the cough, that is one. Another is he is having rhinosynovitis and causing the postnasal drip, that has to be corrected. Otherwise, gastroesophageal reflux disease, GRD or GORD. So, this is also one because of regurgitation of the food, which is going to irritate the upper respiratory tract. So, Kasagna Dhumapana is advised in classics. If you see, Bruhati, Kantakari, Trikatu, Kasamarda, Hingu, Inguditwak, Manashila, Chinnaruha, Karkataka, Srungi. So, Susruta says, Manasila, you remember, wherever the descriptions of allergic manifestations are seen, Manasila is one of the important drugs to be used, especially in Susruta Samhita and also Vagbhata. So, 3 to 4 times per day Dhumapana is advised. Mukhena Vairechanat Kasavan Dhuma Pibet. So, Kasa Pibet Sarpi Madurai Aushadha Sadhitam. So, this is one important which is homely available. Gudodakam Va Koditam Sat Chaudra Maricham Hitam. So, these are all home remedies which are described in Ashtanga Hridaya. Churnam Amalakam Amalakanam Va Chire Pakvam Grutanvitam. And Rasayana Vidhanena Pippalirva Prayojayet. Pippali Vardhamana Rasayana is also one of the. So, commonly used effective Kasahara drugs are Vidaryadikrita, Vasakantakari Leshyam, Chitragharitaki Leshyam, Agastya Haritaki, Vyagra Haritaki, Dashmula Kadutrayam, Vyagradi Kashayam, Sitopaladi Churnam, Rasa Sinduram, Samir Panagaras. Ras Sindur, Samir Panagaras, actually Ras Sindur DST has taken a project to identify its deleterious effects on two models, rat models and Drosophila model. They identified recently, it was concluded in 2013, I think. So, they published papers also. It has no deleterious effects on the lifespan of the Drosophila. So, it is a Samir Panagarasa, which is arsenic content, which is having all the three, Haritala, Manasila and Shankapashpan. Three are there, but this is also very favorite treatment procedure from my side. I used to give in various conditions. So, Kasa is worse and leads to Swasa. So, the sequence is described, and Tamaka Swasa is also widely described in Ayurvedic classics, and symptoms of Tamaka Swasa also known to you, and increased movements on flanks and all those things are there. Bronchial asthma, if you see, the very close to the Tamaka Swasa manifestations, and coughing, wheezing, tightness in the chest and shortness of breath are described. Causes, if you see, cause of asthma is not known as per, it is idiopathic what they say. Parents with asthma is one of the causes, predisposing factors, atopy, allergic nature, that is may be mediated through genes, and childhood respiratory infections. If the individual child is exposed to the infections very frequently in the childhood, they may get the asthma in the course of time. Exposure to allergens are infectious while the immune system developing. So, while immune system is developing in transition, if they are exposed to lot of infection, they also get. So, a variety of things can cause asthma symptoms appear: allergens, irritants, food and drinks, medicines, physical activity, upper respiratory infections. These are triggering factors for asthma. And prenatal and passive smoke exposure in asthma systematic review is also says is a systematic review. Systematic review means they reviewed several papers and they identified that passive smoking in the mother is going to cause the asthmatic nature in the child. So, here you can see the normal airway and asthma airway, how it is, because the three things are happening: the swelling of the mucosal layer, mucus plugging is taking place, and contraction of the bronchial muscles are taking place. Ultimately, the lumen of the bronchial tubes are narrowed. So, that is which causing the wheezing sensation. So, here the treatment aspects described in Ayurveda is application of oil over chest and heart fomentation, that is for instantaneous relief. Snigdha Lavana Yukta Taila for internal use. Mrudu Vatandulomana is a very important thing. You remember, Vatandulomana is to be remembered forever. Vamana Virechana Karma. So, Virechana Karma is Tamaketu Virechanam is described, but Kafavatatmaka is the asthma, Kafavatatmakatva epi. Pittasthana Samudbhava. This is located in the Pitta. It is developed from the Pitta. That is the reason why Virechana is given. And Mrudu Vatanulomana, Vamana Virechana, Dhuman Nasya is also advised. Manasiladi Chu Dhuma. So, wherever you just see the respiratory diseases, Manasila is widely used for the Dhumana, fumigation purpose. Agastya Haritaki Lehyam, Dashamula Kashayam, Sitopaladi, Samirapanagarasa, Kanakasava, Pipalyasava, these are all my favorite. So, as per the conditions of the patient and the age of the patient, I just modify them. And Tylophora asthmatica, studies were conducted on it. And this is Tylophora asthmatica, Ajad Dveshi, this is also called as, this is not taken by the goat, not eaten by the goat. Shellaki, Boswellia serrata, we usually think about Shellaki for inflammatory diseases, but is also proved effective for the respiratory diseases. And this is Shellaki. And Tulasi, aerosols are also, because Tulasi is widely described because it contains aromatic substances. The aromatic substances can be taken out by Arka procedure. The Arka aerosol can be given for the respiratory. This was a study. One of my friends, P.K. Prajapati, who is now the Vice Chancellor of, so under his review it was done. Of course, Ayurveda accepts that Tamakasvasa is a Apya Vyadhi. If it is long lasting, it's only we can manage the episodes. Anulomana drugs are going to play prime role in the management. You remember, Vata Anulomana, the bubbles must be clear every day. So, that has to be corrected. Rasayana drugs like Agastya Haritaki must be given regularly, perennially. So, even in between the episodes also, they can continuously take. It is pertinent to note that caring for adopting regulated lifestyle and diet regimen very essential to overcome. Regular massage therapy. So, massage therapy is also, because once they get relaxation, negative emotions are also going to precipitate the bronchial asthma. So, that is the reason this study was also yoga breathing. Several publications are there. It was a study on 715 patients. Regular use of pranayama techniques are going to improve the FEV1 and also improve the vital capacity of the lungs of the individual. So, allergic respiratory disease management key issues are regular use of Urjaskara Rasayanas. You remember this Vata Anulomana, Vata Kafahara treatment, medicated Gruta must be one of the components of the prescription. Ushnodakapana is very essential. So, these are all the things. Periodical Shodhana by Vamana and Virechana going to reduce the frequency and intensity of attacks. Nasal allergy desensitization can be possible by Navana, Dhumana, Aupidana, Nasyas. And Sthaniya Snehana and Svedana are advised to acute episodes of Vata Jakasa and Tamakasvasa. So, these are to sum up the activity, especially in the allergic respiratory diseases. So, Naimittika Rasayana for Pratishaya is Chitragharitaki, Vata Sleshma Kasa Vyagri Haritaki, Vataja Kasa Vasakantakari Lehyam and Dashamula Haritaki Lehyam, Tamakasvasa Agastya Haritaki Lehyam, and this dose can be given. I regularly practice with these Rasayanas in my, because there is a quotation in Rasaratna Samuchaya, whenever you feel that you are unable to treat the conditions immediately, then you remember about the Rasayana. So, Rasayana has to be remembered whenever you feel suffocated while dealing with the patients, if it is a chronic ailmental conditions. Dashamula Katutrai Kashaya has to be taken in this procedure. Anupana 10 ml Kashayam, 5 ml Madhu, 20 ml of hot water. So, this procedure, this 10 ml, 5 ml and 20 ml of hot water is a very good combination. If you directly take the Dashamula Katutrai Kashayam, so that is going to sometimes not going to give the good results. Vyagradi Kashayam, Vidaryadi Kashayam and Swasananda Gulika are also some of the things. Vata Sleshmahara treatment is Sitopaladi Churnam, Rasa Sindhuram, which I practice regularly. Kafajakasa Sitobala Churnam, Kafakattariras, Samir Panagaras, because some modern doctors also used to bring their children. They ask about the Samir Panagaras. I asked them to verify their trace elements before my treatment and after my treatment. This was given for 3 months every year. Every year 3 months treatment is given, and then they verify before and after the trace element status of arsenic. Because I used to say that it contains arsenic, but you can verify. I am responsible for that. So none of them has the raised arsenic levels in their trace element assessments. So you need not worry about that, because once the Samir Panagarasa is induced or given, administered, the allergic nature is very spontaneously, very fastly recovered in the conditions of even acute. So to avoid day sleep, dust smoke, cool water, perfumes, body sprays, heavy foods in night, these are all things. Antioxidant possibility reduces atopic nature, and very commonly we come across is nowadays young generation is taking their children to all vaccinations. This has become a very fashion now. The children are taken to all vaccinations. A list of vaccines are given by the pediatrician. All the vaccines are regularly taken. Vaccine is nothing but a challenge to immune system. If you regularly mock challenge the immune system will become sensitized to allergies. That is the reason why whenever I get a NRI patient, I will ask them which allergy you have, whether you have skin allergy or respiratory allergy. They must have only either two. So because they are having the mandatory vaccination system in America, so in India we do not have. We have option. For my child, I have taken only 5 vaccinations: triple antigen, BCG, and also polio. That's all. Nothing but more than that. But the risk is not there. So unnecessarily exposing them to all vaccines, this has become a pharmaceutical mafia now. So they are marketing the vaccines through physicians. That vaccine concept has to be gradually nullified by Ayurvedic physicians. Only the important vaccines can be taken. So diet also, Nidana Parivarjana is one of the important things. This of course, this is one aspect of my lecture. Next, you can take the next. So another very important is autoimmune diseases. So both are related to immune system. One is inducing through allergy, immunoglobulin E, by releasing the immunoglobulin E, which is managing or destabilizing the mast cells, and mast cells are going to produce the histamine. Histamine is going to manifest the allergic reactions. So now the another area is autoimmune diseases. Autoimmune disease, our own immune system started targeting our own body tissue. This is also a perverted phenomenon. So these perversions, various causes are there. We have to explore them. So that what, next please, next. Yes, if you see, there is no such disease where autoimmune, living well with autoimmune diseases. This was written by Mary J. Showman. So this is meant for patients. See, if you correct your lifestyle, if you correct your emotions, you can overcome the autoimmune disease. That was her explanation, living well with autoimmune diseases. So there is no such disease condition where a patient-oriented book has come. So this is actually physician-oriented book. This is related to autoimmune diseases, but there is a patient-oriented book. If you follow those things, follow the regulated lifestyle, you will be free from autoimmune phenomena. So this autoimmune phenomena is also Paul Ehrlich in 1906 predicted existence and coined term. This is autoimmunity. That means he said, horror autotoxicus. He said a word, horror autotoxicus. Your own immune system is targeting your own tissue. So immediately that time medical fraternity negated it. Autoimmunity was not possible. Its immune system is a very disciplined one. It cannot produce any toxicity against our own tissue. That was the opinion in those days. His opinion was negated by the fraternity, medical fraternity in those days. So later he was honored by Dutch government. So 200 marks note was, his face is printed in the 200 Dutch mark, so by Netherlands government. So now, why does the immune system attack the body that it is supposed to protect? This is the first question, because immune system is to protect us, but why it is attacking our own body tissue? In rheumatic fever, the streptococcus antigen is very similar to a protein in heart tissue, so the body mistakenly identifies heart. So failure to recognize some cells as self. We have 75 trillions of cells, but all the 75 trillions of cells are identified as self. If any one cell is